want to start with breaking news. The State Department of Public Health is reporting the first human case of Eastern equine encephalitis here in Connecticut. Thanks for joining us here at 4 o'clock. I'm Ben Goldman.
And I'm Jen Bernstein. DPH says an adult from East Lyme tested positive for EEE. Fox 61's Taylor DiCello live in Hartford right now with the breaking details. Taylor.
Well, we want to get right to it. I'm with Dr. Matthew Carter here from the Department of Public Health, and we've been talking for a few moments just about what EEE is. Can you explain to people what it is, what are its symptoms?
Sure. Eastern equine encephalitis, we call it EEE virus, is transmitted by mosquitoes. You can't get it from person to person. And the reason why we worry about this particular virus is it can cause very serious illness. It starts out with a fever and a headache and rapidly moves on to someone having swelling of the brain and people going into coma. That's what encephalitis means. It means swelling of the brain. And this is a very serious illness that requires people to be hospitalized and treated in intensive care unit oftentimes. And so fortunately in Connecticut, this has been really rare in the last 50 years. We've only had one other case reported, and that was back in 2013, and that case resulted in a death. This case we have is still hospitalized, which is the good news, and is a result of exposure probably about 3 weeks ago. This person got sick in the last week of August and has been in the hospital since then. It means that they were exposed to mosquitoes sometime in that last week of August. And the good news for us right now is that it's been 3 weeks since then, and the days are shorter, the nights are cooler, which means that the mosquitoes are less active, and we can see that the risk for EEE is declining. But pretty much this virus can be found right now throughout southeastern Connecticut and in the towns along the Rhode Island border. And many of those towns have already taken special precautions, especially for school children, in terms of school schedules to reduce the risk for mosquito bites.
What can people do now to make sure that that risk is even lower of catching EEE?
Well, people, if you live in an area, especially near a freshwater swamp or in one of these towns where in southeastern Connecticut or along the Rhode Island border, if you can, minimize your outdoor activities, especially between dusk and dawn. Those are the times when these mosquitoes are most active. If you have to go out, dress appropriately, long sleeves, long pants, for example, or try to minimize the skin that's exposed to mosquitoes. Use insect repellents. Many of the ones that work best contain DEET. These are all things you can do in terms of trying to reduce your risk of getting a mosquito bite.
Thank you so much, Dr. Carter. So far, mosquitoes testing for EEE have all been found in 12 different towns in Connecticut, mostly along the southeastern border of our state. You can find a list of those towns on our website at fox61.com. Live in Hartford, Taylor DiCello, Fox 61 News.